People want to know what's going on, and they want to know what you have to say. Yesterday, Aetna said they're out completely. Delaware, Nebraska, they're no longer doing plans for the ACA. How do you read what's happening politically and to ACA right now?
Let's start with good morning.
Good morning.
Hope you're doing well. Hope you're thriving. You didn't tell me that this was going to be. No, I'm kidding. I'm kidding. It's great. It's great to be here on a critically important topic. So first, when I look at the big picture, we now have, for the sake of this, we have about 320, 330 million people living in the United States. 150 million of them are covered by employer-based coverage. About 60 million are covered by the government in Medicare, about 70 million Medicaid and state programs. Today, roughly about 20 million are now covered through the ACA and the exchange. And there are still 30 million who are uninsured. 30 million. We have always said that from a Kaiser Permanente standpoint, that everybody should have access to the front door of the American healthcare system. So we still have 30 million people who do not have access to the front door of the American healthcare system. But that's only part of the problem. The other part of the problem is you can have access to the front door of the American healthcare system, but you can't go through that door if it is still unaffordable in terms of what you have to pay. That's where my energy is spent every single day. How do we solve to the access and the affordability and the availability of healthcare for everyone?
But at least when I talked to Mark Bertolini in a very similar interview just a few months ago, he used the term death spiral. Is that a fair characterization?
Well, in terms of how I think about it, because I don't think about it from an insurance standpoint,
right.
I think about it from the people standpoint. People need access to care. What we can tell you in Kaiser Permanente, there are people who have never had coverage that now are part of the Kaiser Permanente system, and as expected, they behave like everybody else, right? You work them up, you get them going, and then we have designed a medical care program through our Permanente medical groups that provide great care to them, and that's what they're after. And so I would not use that term because we have 20 plus million people getting access to care now through the front door. That's progress. We still have 30 million more who do not have coverage. We have more work to do.